Dr Bloomfield.
Thank you, Minister. Kia ora koutou katoa. Just before I provide further details on the case, I'd like to also confirm that there are 6 additional managed isolation cases to report today, and the details of those will be in our media release. So contact tracing on the case that we're calling the Northland case, January Northland case, has identified 15 people who are being treated as close contacts. The reason this number has gone up is that there are 13 of them who are in 2 retail settings, and it's not immediately clear which of these people served the case, and so all are being treated as if they are close contacts. That's why that has gone up from yesterday. All have been contacted, are self-isolating, and have been tested. So far we know that the woman's 2 closest contacts have returned negative tests, which is encouraging. As the Minister has said, the results of the whole genome sequencing confirmed she has this, what is known as South African variant. It was a variant first identified in South Africa, known as the B.1.351. Now, we're continuing to monitor advice from the WHO on this variant and all other new variants that are identified. However, there's limited epidemiological data available to date on it. What we know so far is that it may be more transmissible, but that's not as clear as the information about the variant first identified in the UK. There are no indications to date for any differences in disease severity or in incubation period. There's some evidence that this variant may evade some aspects of the body's immune response, but obviously it's very early and we will be watching closely just to see, as will other countries, what this means. Now, new forms or variants of the virus have become increasingly common around the world. The key point here is they are now global. They are not confined to specific countries. And we have expected to see them in New Zealand. One of the things we do here is, of course, we do whole genome sequencing on every positive case we get here. So we have a very good data bank of our variants that we've seen in New Zealand. So further on contact tracing, just to talk a little bit more about the case's movements around the community in Northland, I do want to acknowledge, among other things, her frequent use of the NZ COVID Tracer app, scanning QR codes and having Bluetooth turned on. As we've now published on our website, last evening the list of 30 locations of interest was put up, and it's the use of the app by this person that has enabled us to follow up quickly anyone who may have had contact with her and to head off any further potential spread. We do this as a precaution in situations like this, and I can't thank the person enough for her dedicated use of the app. Remember, this could be anyone at any time, and it's up to all of us to help protect each other. The message here is clear. Everyone on the team needs to scan QR codes and enable Bluetooth on phones and on the app. And pleasingly, an extra 200,000 people turned on the Bluetooth functionality on the app. Done that, to do so, and of course to everybody, to not only have the app on their phone, but to use it assiduously. Last night, as many locations of interest as possible under the time constraints were contacted to alert them that they would be listed as a potential exposure event. We were not able to get through to all of them, and so by yesterday evening we made the call to publish the list of those sites and to send out a push notification to people who had been there. We've also published on our website the potential exposure date and timeframes, and in some cases this is just a 5 or 10 minute period. So when people call Healthline, we want them to be mindful of the date and time of exposure for that location. We need to ensure that our testing stations are testing as a priority those people who were there at those time and dates, not people who may have been there at another time or who are just worried. Of course, anyone who is symptomatic should go and get a test and isolate until they get the results. Push notifications, as I said, have been sent to app users, and the Bluetooth, those who had Bluetooth turned on and may have been identified as being in proximity for a period of time to the case have now been sent a notification as well. And what I can say is there were 162 push notifications to people through the app who had scanned in at the same time into those locations that the case was at. A word on testing centres. There are now 17 additional centres up and going across Northland and Auckland metro region. There is high demand. As I said earlier, we want the people who were at those places at the same time and date to be prioritised for testing. There are a lot of people turning up in Northland who are neither symptomatic nor were at the places. Can I ask those people to stand back and ensure that those who are the priority to be tested first? There is community testing in a range of places around Northland, and those are on the DHB's website, and likewise the Auckland locations are on the Auckland Regional Public Health website. By 11 a.m. this morning, nearly 1,000 people had been tested across the Auckland region. For comparison, at the same time last Monday, that was just over 200. So it's great to see the response. We do want to ensure it is the right people being tested. Remember, as the Minister said, if you are symptomatic, the important thing is to stay home and get a test. Just a reminder that healthcare facilities across Northland remain open. I understand that there are people who are not turning up for appointments at the hospital because they may be concerned. There is no increased risk in going and attending a medical or other appointment at the hospital or anywhere else, and please do get care in a timely way. And finally, the number of tests yesterday was 2,678, and quite clearly we expect that number to be much higher today. Thank you, Minister.